Hey everybody, this is Joshua with the Tendonitis Expert. And this video is about heel spur symptoms and what really causes them. Hint, hint, it's usually not the heel spur. So, let's start with what causes heel spur symptoms. And there's some clues here: bone and all the muscles and connective tissue over the top of it. So let's take a closer look at that. Bone spurs usually, while they can kind of show up anywhere, mostly they show up under the heel, like where you land when you heel strike, and somewhere around here where the Achilles tendon attaches. So an important factor to understand is that bone spurs don't just show up for no reason. They don't magically appear. They don't randomly appear. If bone spurs show up, it's for a reason. Your doctors may not have a great explanation for that, but essentially the explanation is bone spurs show up where forces are pushing or pulling on the bone. So that's why right here is very common and here is very common, such that every time you take a step, you're putting pressure on the bone. And muscles, which ideally should be that long, over time get short and tight. Connective tissue shrink wraps them so they're stuck tight, so they're constantly pulling on the tendon too much. So whether it's a push pressure on the bone or a pull tendon on the bone, the brain thinks that this needs to get stronger. And so it tells it to grow some more bone tissue to be stronger. It's not necessarily the smartest thing in the world, but that's what it does. So that's what causes bone spurs. Now you're only going to know that you have a bone spur if you already have pain in this area. Generally, you go to a doctor because you have pain in here. Maybe you've already tried some other things, but then you get an x-ray, and the x-ray shows some bone spur or some bone spur. And the doctor goes, well, there's a bone spur. That must be the cause of the pain. But that's not necessarily true. If the only proof for that is that lots of people have bone spurs and are bone spurs just like you, but they don't have pain. So it's not necessarily that the bone spur is 100% the cause of the pain. Point being, you can have your same exact symptoms with bone spurs or without bone spurs. So why might that be? Let's take a look. Clear this out of the way. Okay, so what causes pain in general? Muscles, as I said, over time get tight, and they pull on the tendons too much, and that pulls on the attachment too much, constantly 24/7. The tighter this gets, the more it pulls on the tendon, the more it pulls on the attachment. Long story short, over time that kicks in inflammation response, which releases chemicals which enhance your sensitivity to pain in the tissue, and that causes more pain, and that causes muscles to get more tight, to pull on the tendon more, to pull on the attachment more. Repeat, repeat, repeat. Eventually you feel pain. Maybe in there you may or may not be growing a bone spur. So there's a whole pain dynamic in play, and that pain dynamic is also what causes bone spurs. Point being, you can have pain with a bone spur or without a bone spur. Another point is, just because you have a bone spur does not 100% mean that you're going to have pain from that bone spur. So there's two scenarios if you have pain. The first is you have actual pain from the bone spur, and the second is that you don't have pain from the bone spur. And let's clear that out again, and we'll talk about that. So again, two scenarios of your pain. One, the bone spur is causing pain, or two, it's not, even if the doctor says it is. So the scenario where the bone spur for sure is causing pain is if it's on the heel. So there's your heel, there's extra bone tissue growing, there's some connective tissue, maybe some ligament attachment, maybe some tendon attachment, connective tissue. There's lots of connective tissue all around here. And then you have skin. So now that bone spur is growing and pushing that out. And every time you take a step, that's irritating it. It's like you're hitting yourself with a hammer a little bit, a bunch, over and over and over. And then you have an actual physiological, anatomical problem. Every time you step on that bone spur, it's a pointy pressure. It's going to cause actual pain and problem. So in that scenario, yes, that's a problem. If you have a bone spur here, however, let's clear that out again. However, if you have a bone spur here, notice that this attachment is coming and attaching to the bone right there. So this can be problematic because the tendon comes down, it attaches to bone, and you have bone spur maybe growing right there. So it's affecting the attachment, it's affecting the structural integrity and the function of the tendon itself, and that's going to send pain signal to the brain. Not good. Having said that, just because you have a bone spur here, or here, or here, that doesn't necessarily mean the bone spur is damaging the tendon or is injuring the tendon. Having said that, it can. The more your bone spur is growing up into the tendon, it's pushing the tendon aside, it's displacing it, and it can actually be damaging that tendon. So in that scenario, the symptom of the bone spur there is actual tendon damage. So in that scenario, yes, the bone spur is problematic and it is a cause of pain. But if it's not, then it's not. I know this sounds like an obvious statement, but in some ways it's kind of hard to tell. So you kind of have to go with the theory a little bit more than the actuality. The point being, just because you have a bone spur doesn't necessarily mean a bone spur symptom is damage to the tendon. If it is, that's a problem. So if I were you, before I got bone spur surgery to remove it, because the surgery is going to get in here, it's going to grind out the bone, but it's also going to damage the tendon. So it's not necessarily a magical fix. It's going to be problematic as well. Often they detach the tendon, well, not there, but they detach the tendon, carve away the bone spur, and then reattach the tendon. So that is very, very, very traumatic to your system. So here's what I would do before I did that. I would deal with the tightness of the muscle and connective tissue, because remember, muscle gets short, connective tissue shrink wraps, and then it can't get back to length. And I would deal with the inflammation process that's releasing chemical here, which enhances your sensitivity to pain, which increases the tightness. Point being, and it's a little bit diagnostic to tell whether you have actual heel spur symptoms or not, is get rid of the tightness, get rid of the inflammation process, and then see what happens. If you essentially get rid of the tendonitis dynamic, which is tightness, inflammation, and nutritional insufficiency, essentially, if you get rid of those three factors and your pain goes away, then it's not a bone spur symptom. Your pain is not a bone spur symptom. But if you get rid of the tendonitis dynamic and you're still having various symptoms, then the bone spur might be actually causing damage. And in that scenario, then you might want to take a drastic action and do something about it. But first, I would absolutely deal with the tightness, the inflammation, and the nutritional insufficiency. Because if you do get surgery and grind that off and detach your tendon and reattach it, that's super problematic, and you're still going to have all the tightness, inflammation, and nutritional insufficiency that caused the bone spur growth in the first place. So deal with the tendonitis dynamic, deal with the underlying cause first, stop the bone spur from getting bigger, and then see what happens. If you'd like to find out more about heel spur symptoms, then visit my website, tendonitisexpert.com, and find the appropriate page right there.